This is a new presentation for a grand round, this time for 5041 class. My name is Maitek Medina. This is about a patient admitted in West Gable Hospital Rehab. He's a 54-year-old white male with history of high blood pressure. Started with asthenia that made very difficult for him to perform basic activities of daily living, of progressive installment for about 30 days ago. Patient thought it was due to the medication for the high blood pressure and went to his primary provider to ask for medication change. Patient has been admitted in this hospital and started treatment. Once stabilized, patient was transferred to this facility to continue his rehabilitation. Allergies: no known drug allergy. Past medical history: essential hypertension, dyslipidemia. Past surgical history: none. Hospitalization: no prior hospitalization to the one above mentioned. Current medications: doxorubicin, vinblastine, prednisone, metoprolol, loperamide, simvastatin. Family history: father passed away of hypertension and mother heart arrest. Social history: patient is married, has 2 grown-up children, lives at home, works as clerk, denies consumption of alcoholic beverage or recreational drugs. 30 packs years smoking history. Revision of systems: general, positive for asthenia, weakness, nocturnal fever of 101 Fahrenheit degrees, profuse sweating, head, ear, eyes, nose and throat, denies ear pain, nasal discharge, sore throat. Neck patient noticed a swollen gland of his neck that became painful when he had a drink at a party 2 weeks ago. Lungs: denied cough, dyspnea, sputum production. Cardiovascular: denies chest pain, racing heart. Breast: no complaints. Gastrointestinal: denies vomiting, nausea, diarrhea. Diffuse abdominal pain is noticed, but the patient is positive for that. That discomfort is not related with meals. Genitalia: no complaints. Genitourinary: denies dysuria, dribbling, hesitance, back pain. Neuro: denies seizure, loss of consciousness, visual change. Continuation: musculoskeletal: generalized weakness, positive for that interferes with activity of daily life. Activities and exercise decreased due to generalized weakness. Psychosocial: patient, as above told, is married, lives with his wife and daughter, has a support system in place, and does not consume alcoholic beverage, tobacco, or recreational drugs at this time. Dermatology: positive for pruritus at times without lesions. Nutrition: patient eats normal diet, no restrictions. Sleep and rest, wake up at night sometimes due to sweating. Objective: vital signs: blood pressure 126/76 millimeters of mercury, respiratory rate 12 per minute, heart rate 72 per minute, temperature 98 Fahrenheit degrees, height 5'8", weight 188 pounds, BMI 28.6. General: ignore acute distress, ill appearance, weak. EENT: normocephalic, atraumatic, pupils of normal reaction to life and accommodation, normal extraocular movement, ears no pain or pulling, nose no discharge, throat clear. Neck supple, several adenopathies of renitent consistent, non-mobile, of medium size, non-painful, of 3 centimeters of diameter, posterior to sternocleidomastoidea muscle, left side. Pulmonary: normal vesicular sounds, no rails. Cardiovascular: regular rate and rhythms, no murmurs, rubs, or gallops. Breast: no palpable masses, no skin changes. Abdomen: soft, non-tender, non distended. Spleen is palpable and also percurable 2 centimeters below costal margin. Bowel sounds audible, normal intensity, 4 quadrants. Rectal: normotonic sphincter, no prostate enlargement, no indurations. Genitalia: normal male genitalia. Musculoskeletal: muscular strength 5'5", in all muscle groups, no sign of bulky atrophy. Neuro: alert, oriented in 3 spheres, memory conserved, cranial nerve 2 to 12 grossly intact. muscular strength normal, no dysarthria, no abnormal movements. Diagnostic. Assessment: Hodgkin disease. Differential diagnosis: non-Hodgkin lymphoma, Burkitt's lymphoma, chronic myelogenous leukemia, cytomegalovirus infection, HIV initial infection, infection mononucleosis. All of this we are ruling out because of the labs and because of the clinical presentation. Significant test: CT of thorax, no para-aortic adenopathy seen, biopsy of lymphatic node of neck, Rick Stenberg cells noticed. This is the diagnosis. CBC, hemoglobin 11.1 grams per deciliter. Plan: consult with an oncologist, consult with the hematologist, current therapy, and see the cardiologist for the essential hypertension. Some facts about lymphoma Hodgkin's. Lymphoma Hodgkin's is a type of lymphoma that originates from lymphocytes. Main symptoms are fever, night sweats, weight loss, non-painful adenopathies. Risk factors are infectious mononucleosis, Epstein-Barr virus infection, HIV or AIDS. It is relatively rare form of lymphoma, 10%, but affects 200,000 of Americans each year. It is the most curable form of cancer with survival rate at 1 year of 90% and 80% at 5 years. 90% of patients treated at early stage are cured. Treatment is aimed at killing as much neoplastic cells as possible. Treatment: chemotherapy. It could be alone or more effectively combined with radiotherapy to reduce the size of the tumor. Chemotherapy has side effects like anemia, hair loss, gastritis, dermatitis, and others. Radiation also has side effects like trismus, dermatitis, and others. So you can see the reference. Thank you for everything. Good morning.